Exhale. Let the air out. It's okay. Try not to overwhelm you.
Oh, that one got hurt.
I got you. I got you. Deep breath in.
Sorry.
Deep breath in. You're good. I know stuff. This is not going to be easy. I know. Go. Let it go. There we go. Oh, boy. Breathe. Okay. I got you. The lower back nerves, if they're upset, you don't have to have any lower back pain. This can be confusing because the only thing that really causes pain is joint inflammation in the spine. You can you can have sciatica with no spinal pain. This can be confusing because it's like my back was fine. If the nerve is pinched, the very first thing that happens when you have a nerve being hit is muscle spasm. That's generally the first thing. As the nerve is more irritated, you'll get pain, and then as you get more irritated, it goes numb. So that's sort of a progression that we see when you're hitting a nerve. If you have pressure on this nerve, these MRIs are probably taken laying down, right? Mm-hmm. Which is, I'll get into that, it's kind of silly because there's no gravity on your spine. So even with no gravity on your spine, we're seeing a herniation. Herniations medically take 10 to 15 years, the research. It's like a cavity in a tooth. It can't form in 3 years or 5 years. It's a minimum of 10. Mm-hmm. So
I mean, I went to the hospital when I was 18 and I herniated my lumbar disc. So those have been there for a while.
Right.
It never bothered me.
You're very young, 31 years old, and so, probably when that 13, that's probably when the disc injuries, exactly what you're saying, that's when they started. My point is that pressure on those nerves will cause spasm. The main thing that I would think could injure you is treatment on the lower back. Anybody tractioning hard on you, pressing really hard into your lower back, that will injure you. If somebody further aggravates that disc in the lower back, which is non-regenerable, that's what I sort of value the most. That injury to that disc is not good. If she just worked on your leg, I don't think that's, first of all, I think it's redundant and unnecessary, and it's like you're chasing the carrot. I wouldn't even work on your leg in that situation. But she's not had 8 years of training, or, it's okay. But that is silly to work on the leg. But I'm not, if she worked on this and she worked on this, or she put you in a compromising position, which put pressure on the sciatic nerve, you can damage the lower back, from constant aggravation of L5, because maybe she didn't know that at the time, but you have disc injuries in here, and these disc injuries need to be left alone by so some of these words of the joint, facet hypertrophy means the joint has grown. There is no stenosis, mild on both sides, the hole is smaller. So that's what those words mean. Minimal with pressure on the front part of the spinal cord is what those words mean. So you're having pressure on the spinal cord from the disc, and the joints are growing. My main actual thing on this report that I look at be the most fascinating is that in the first 3 guys, so there's 5 lumbar vertebrae, right? So the first 3 guys, they're saying it looks great.
Yep.
Nothing to see here, nothing to see here, nothing to see here. And then the last 2 guys, I make this point a lot in my videos, have a big paragraph. You have a paragraph describing the damage to the segments that has happened at the bottom, but yet you're 31 and these guys still look 18 years old. There's no evidence of aging on the last 2 guys, or upper 3 guys. The last 2 have all the aging. So my treatment is almost only on these guys. You understand? I try to work not on the areas that are damaged, but on the areas that are not damaged to take stress off these ones that are injured. Any chiropractic treatment on the lower back is silly. Any type of manipulation of the lower back, that's why your body's rotating. Mm-hmm. So when for instance, if I tilt to the left, the hole on the right gets bigger. So it'll, somebody with right sciatica might walk around, and say, I feel fine, mm-hmm. Right? But you're just in avoidance. And so even if you're hurting and you're in antalgia, it just means that it's progressed for a little bit more than, that's why it's been here for years, or you've been dealing with this for a while.
Yeah.
That numbness in your leg, where exactly are you, is it numb right now?
No, but it was before.
When was the last time it was numb?
Probably like 2 minutes ago.
Okay.
Yeah, so I go like this and I just adjust it, because it's I try to wake it up.
Okay. Was it numb when you were sitting there?
No.
Or on your drive here?
No.
Okay. It just got numb when you stood up? I'm just trying to figure out what you said 2 minutes ago.
Yeah, so there's really,
Hard to track it.
it's hard to track it. I have for 3 years.
Where do you think it's numb the most? Is there an area that you can show me?
From here through here, and sometimes it goes like here.
Okay.
It
But the foot's okay?
Foot's okay.
Nothing below the knee, nothing at the calf or
Nope.
shin, just all the quad side of the thigh?
Yep.
Okay.
And it's cold.
How about the back of your thigh?
Nope.
Not the glute, just here? Okay.
Just, yep.
Okay.
Yeah, yeah.
Interesting, because that, usually when you're dealing with these last two guys, we call them dermatomes. Each section of your body has a specific nerve root that goes to it.
Mhm.
So these two nerve roots are your foot. Your pinky toe is this guy, the top of your foot is this guy.
Mhm.
So the areas that you have disc herniations doesn't directly match up with where, I'd have to see this, I want to see this picture, is my point. This is a report, which is
Yeah,
somebody's
I have the
opinion.
disc if you
Do you have it?
want to see
I would love to pull that up. Yeah, just here's where the disc injuries are.
Mhm.
The nerve that goes to that area is about here. So, what's going on up there? There could be just a lot of inflammation in there, and because you don't have any foot symptoms, it could be. Here's one thing it could be.
I do get some numbness by the toes a little
Some?
bit, and that was only after the first chiropractic adjustment I had last year.
Sometimes I've seen people where, it'll go down the leg. So sometimes it'll begin this, but but you've been feeling that for 3 years, you said, right?
3 years.
It hasn't progressed to. Usually it'll be like as the foot arrives, it's because it's going down. You understand? So you're feeling this, and then a month later, yeah, this is gone. Now I'm just feeling it in my foot. You understand? Because the problem is progressing.
Mhm.
But I would have expected it to already happen. Like you might tell me at the beginning, I felt it here when she worked on me. Then a month later, it moved down to my foot. That doesn't line up. Something's not lining up. I'll try to figure it out. But
I got a massage just because I wanted to loosen up some muscles.
right,
I was laying down, and she put all her force into this area. So if she was standing there, the force went in here, and I felt something up in my back.
right.
And when I got off the table, both my legs went numb, and this leg's been numb ever since, on and off, and this one maybe a few times a week.
And then you said, but after a chiropractic adjustment, you think it. Tell me your experience with the chiropractic.
The chiropractic adjustment was just to kind of help alleviate the numbness.
But it didn't do that, or
it
did, or
didn't, no.
okay. All right,
You
I don't.
had numbness then in your foot. Sorry, I just heard you.
So after my first chiropractic adjustment, the doctor told me to go home, and he's like, ice your back and put a blanket over you to keep the coldness in. But I felt the numbness in my toes, but it went away. I get it on and off, but it's not something that bothers me too much.
See, that to me, that would be an aggravation of L5. That's the aggravation of those discs. You
Okay.
understand? That is L5.
Yeah.
The upper thigh is either the beginning of that nerve, or there's another injury which I need to find in there that isn't visible on your MRI, because the L1 disc looks great. So
Okay.
I don't. That could be mainly soft tissue in the upper lumbar. I'll see in a second when I look at your back. Let me have you on your back here for me. Yep. All right. Take one deep breath in for me. Have a little healthy little sit up. Deep breath in, head back for me, and then exhale for me. There we go, exhale. Deep breath in, I got you, I know. There you go, exhale. Let the air out, it's okay. Try not to overwhelm you.
Oh, that one got
I know,
hurt.
I got you. Deep breath in,
Sorry.
deep breath in, you're good. I know it's tough, this is not gonna be easy, I know, this is the cause. Exhale. Good, all right, we're done, I know. Yeah. I know. You understand, like I said earlier, there has to be a stiff area that caused this to get injured. Do you understand? That is it. Ed?
I believe you.
That did not feel good. Now, has anybody done that before?
No.
Right. So you understand how, we can put you in your hands, relax.
Okay.
But you get my point?
Yeah.
Nobody's found your cause. That is your cause. I've been adjusted 6 days a week my whole life. You understand? There is no difficulty. No, they're just joints.
Yeah.
It shouldn't be the end of the world to bend your joints. I just asked your middle back joints to move, and I don't like that, Ed. That didn't feel good. My hand was right over that bra strap. Do you understand? And I don't expect a joint that's been bound up by a brace to embrace me with open arms and, yay, that felt great to be adjusted, Dr. Ed.
Mhm.
That is your cause. Care needs to progress to a point where you're able to handle that and it's easy. That would be our goal. Be able to handle a thoracic adjustment and it not be the end of the world. And it progresses to, Ed, that was a lot better, that wasn't so bad. You know what I'm saying? Over a period of 6-8 visits, we'd be able to get to a point where that wasn't that difficult. It's pretty tight, and I know, okay, all right, yep. Relax your head, I got you. I won't drop your head, I know. I got you. Beautiful. They're just joints, they're just knuckles in here. So this, where you're bending too much is down here. This is where that T1, C7, this is where the numbness that comes into your hand. So nobody should ever go pushing hard in your lower neck. If anybody's doing that, you need to get out the door or stop, right? Leave my injured areas alone. Yeah, it's gonna be, and then tomorrow morning, oh my Lord, Ed, it was so tender in my upper neck, I know. I got you, all right, turn your head right, I got you. Feel the difference, how this is nice and smooth over here? Can you feel the difference? All right. Generally, and that's why, which hand was it? It was the left hand?
Started with the left hand,
Started with the left hand,
and then
now,
the right
and the
hand.
right, okay. So you're in what we call right avoidance, which means usually the left would be the one that has the numbness. You're abusing the left side of your neck because the right side had an injury or something is causing you to want to turn away from the right, and then the compensatory pain symptom is on the left. This side actually feels healthier, but will generally be the area that hurts because it actually functions. We don't feel symptoms in the areas that don't work. We only feel symptoms in the areas that are being abused.
I feel it up there.
Yeah, this is all what's locked up here. We need to unlock your upper neck. Doing good.
My jaw is also popping out. Is that?
That's from your head being forward.
Okay.
So the jaw is jammed. The more forward your head goes, the more the temporomandibular joint is jammed. I address that. That generally goes away as I'll show you. As your head, I know home is here. Head back up. I know.
Doesn't bend.
I know. It doesn't bend this way, right? I know. It's actually another inch deeper, but I'm testing you out. I know.
That's it.
Okay, all right. Get the idea though? You understand what I'm trying to say? This is, so we do the adjustments and the deep tissue massage to help coerce your vertebrae to unlock them so that we can allow you to start stretching your body and maintain that curve. The head being forward puts a lot of torque on your lower back. So even, Ed, I told you it's down to my leg. I know, but having your head forward and having the curve in your neck straight or reversed puts a lot of torque on your lower back. And so fixing the neck helps to take stress off the lower back. Little baby adjustment. I got you. Relax here. Okay, real gentle. I got you. A little deeper. Here we go. Let it go. There we go. Oh, boy. Breathe. Okay. I got you. I know. That bone hasn't probably moved in a while.
Feels like it.
I know. And there. Turn your head right. I got you. There we go. Pain? What?
No, it doesn't turn anymore.
That's it. Okay, I got your head. I got your head. I got you. It's okay. Real gentle. It's okay. It's okay. I got you. I'm not gonna hurt you. Breathe. There we go. I'm waiting. Let it go right here. All right, I'm done. It's okay. It's okay. Yeah, that side's pretty tight too.
Yeah, it's
I know.
down here.
Yeah.
Does it
Yeah.
move?
Yeah. Yeah. I feel it. Yeah, when you go to Publix later or something, everybody's gonna look at you and go, "What happened to you, honey? Is your boyfriend being mean to you? You getting a little hickey action on your neck? What's going on?" He was a chiropractor. Ooh. Weird. Kinky. What's so funny is that half the world is very familiar with this. It's really only our country that's very unfamiliarized with a lot of soft tissue work that's commonly done in our planet, but we're a big pharma country. Everything's got to be able to be treated by a pill or a drug, and it's just not done. So I've had people from Hong Kong and Bali and Java, all these other islands over there, and they're like, "Yeah, massage and gua sha." Not gonna go too crazy, but there's a lot in there,
You
and
can
it's
keep
like,
going.
okay, you okay? All
Yeah.
right. Just want you to be able to move your neck tomorrow. Ah,
Right.
this guy dug on my neck and bruised me up and pushed on me real hard, and I'm really tender. Yeah.
It wasn't a bad drive though.
Good Lord, let's get these down. Mm-hmm. It's snow. I got you. Just trying to unlock this a little bit. There we go. I'm waiting. Breathe. Relax here. Let it go. I'm waiting. There it is. Yeah, I know. That is stuck. That is a tight joint right there.
Even all the way up, it's the further up you go, the tighter it feels.
That needs to go away.
What is that?
Right. Oh my gosh. It's like there's layers. It's like I'm picking up the clothes and I'm seeing stains underneath the. That makes sense. There's a little injury. That's an injury right there. There's an alien in there. Which leg was it? Was it the right, left leg? Which leg?
Left.
Left leg is the most numb. Okay.
And I have this pain, I guess,
Yeah.
like close somewhere here.
Yes.
Excruciating.
Okay. All right. Right now, it's hurting right now, or?
Yeah, it always hurts.
Oh my. All right. Like I said earlier, I'm trying to spread some of the work up to your upper back. Is that leg numb right now?
No.
All right, if it goes numb, please let me know if you feel like it does start to go numb. Or if any symptom, I understand you might already be hurting, but if anything starts hurting worse, let me know. We're trying to do something to the injured areas that we lose sight of the uninjured areas, and that's the main problem, and that's what needs to be guided in terms of finding somebody on the East Coast, is that if they're just trying to do some sort of laser treatment or therapy on your lower back, next, and you have to search out people that, maybe, and like I said, my father's who trained Brenda and I, and my dad, through the course of searching for care for his own spine, was actually injured by chiropractors that continued to adjust him in his lower back. That's how I know further manipulation of the lower back will injure you. Does that make sense? Because my father is the example, and being a kid, my sister and I were tasked with trying to help my father, and he couldn't find anybody to help do what he wanted done on himself. And so, we were teenagers learning how to feel backs and examine posture, and it was like we were going to be chiropractors whether or not we wanted to, or at least know how to do this. And out of necessity, my dad really was pretty injured, and he was injured before he went to chiropractors. He had injuries when he was a kid that put a lot of stress on his lower back. He rode cross country on a motorcycle in a seated reclined position, which, that makes sense, put a lot of pressure on his lower back. And then he lifted something that was very heavy with a stiff middle back, so all the pressure went to his lower back. And so, doctors didn't get involved in his life until he had 2 disc herniations in his mid-20s, and his back was already destroyed. And now he's late to the game. It's like an engine. It's already blown a head gasket, and now you're trying to learn how to take care of your car. It's like, I blame...
He got help from the chiropractor at first. That's why he became a chiropractor.
Right.
But then in school is where the final injury.
We know this in many areas in life. Prevention is always... But for whatever reason with our spine, we're left to just wing it.
It's crazy
Just-
to me.
Just wait till it hurts, or how you feel. Oh, you're hurting? Oh, you feel great? Okay, see you later. You understand? And you especially can't use pain when it comes to the spine, because not everything has feeling. So therefore I can't use, on a scale of 1 to 10, tell me about your pain today, and tell me about your symptoms. And, I use symptoms to help understand the picture of each person's spine, and your alignment, your mobility. They're all little pieces of the puzzle which draw the picture of how to treat you. you're 20 years late to this. We're late. This has already, like a big oak tree by the side of a brick driveway. You know, the roots are all coming up and making the bricks, and people are trying to do things to the bricks, but the tree needs to be worked on. It's the tree that's causing the bricks to become uneven. This alignment and this mobility here is what's putting the stress on your lower back.
Something's popping out up there.
Yeah, you feel it? Yep.
Yep.
Yep, right there.
What is that?
Yeah, this is the injuries that have been, I know your middle back has had to go through.
In the beginning, the best way I used to explain to everyone how I felt is I felt stuck. Like
Right.
I literally felt stuck.
Right.
And I was like, why is nobody understanding what I'm telling them?
Right, because they only can treat symptoms and diagnoses. You understand, something that can be measured on a picture, and because this area, you know, I know there's 2 disc injuries in there, but they really don't treat these area. They don't, you know, there is no treatment on the chest. Everybody focuses on the surgical areas. And yeah, right there you got an old injury. That's where that sort of click right here.
Mm-hmm.
It's pretty, you know, well, right there. That's an injury in there. Very good. Yeah. Not there, Ed. So like I said earlier, oxygen's what allows a muscle to contract. Oxygen's also required to get a muscle to relax. And so a lot of this is trying to drive a lot of blood in here to bring nutrients in, oxygen in, to allow the area to relax. Now ultimately it gets stiffer again because your head's forward. Does that make sense? That's why we have to get your head back. As the head goes forward, does that make sense? This gets tight. So it's usually a handful of adjustments to get your spine unlocked so we can start stretching your body to get your head back, which then alleviates this stiffness. It's a postural stiffness, but temporarily you can help just alleviate some of the tension and stiffness by working on the area, and then obviously working on the area is what is required to unlock it. These are the roots of your neck right here, and so unlocking these roots, pushing them down, helps to get the head back. We have to sort of stomp these roots down to then bring the tree upright, and then these roots will stop coming out of the ground. These are the roots of the neck. Trying to unlock the mobility of your upper thoracic. So the lower neck has been overstressed. The upper back needs to be loosened. The upper neck needs to be loosened. Right there, yep. Wow, right there, yeah. What is it, Ed? What is that? All right, all right. I got you. It's okay. You okay?
Yep.
Okay, good, good. That's all. It shouldn't be any harder than that. You
Yep.
understand? It should not be any. You don't want to be going real, you know, they're jumping on you. They're it's too much. I'll put that right over that spot. I got you. Lay back for me. Lay back. I got you. Come on. Come on. Come on. There you go. You want it a little bit lower? Is that?
I could do a little lower.
Yeah. Let's see if I can. I want it to emulate just right where you're.
That's where it hurts.
Usually, bend your knees for me. It might be a little bit easier with the knees bent. There we go. Get the idea? And you're just trying to do time molding this arch into your spine. So you can find deep tissue work to unlock your spine, make your spine flexible and malleable, and then molding this arch into your spine is what's going to prevent that symptom from just happening and reawakening so quickly, where I'm just standing for a couple minutes and it's intermittently going on and off like a flickering light switch. We got to get that area to be more stable in there.